Now that you understand what causes torn ligaments, let me share the specific supplements I recommend to my patients to support healing and recovery. First, I always start with vitamin C at 2,000 milligrams daily. Your body needs vitamin C to produce collagen, which is the main structural protein in ligaments. Without adequate vitamin C, your ligaments simply can't rebuild properly. I tell my patients to split this into two 1,000 milligram doses. Next is glucosamine sulfate at 1,500 milligrams daily. This provides the building blocks for cartilage and connective tissue repair. The sulfate form is crucial because sulfur is essential for ligament structure. Don't waste your money on glucosamine hydrochloride. I also recommend MSM at 3,000 milligrams daily. This organic sulfur compound reduces inflammation and provides sulfur for collagen synthesis. Many patients notice reduced pain within 2 weeks. Finally, add zinc at 30 milligrams daily. Zinc is a cofactor in collagen formation and wound healing. Without it, tissue repair slows dramatically. But how do you know if you actually have torn ligaments? In my next video, I'll tell you exactly what lab tests to ask for.